Hi, thanks very much for coming here. I'm Dr. Jamal, old age psychiatrist. We all are aware of Botox, botulinum toxin, and we know that it is usually currently prescribed for muscle spasticity following stroke or traumatic brain injury or even in migraine. But mostly it is used for cosmetic reasons. But usually what happens is that, Botox creates a feel, usually how we express emotions. So we have this facial feedback loop where, say, on our forehead we frown, isn't it? Whether we are happy or sad. So through the facial nerve, it stimulates the proprioceptive fibers of the ophthalmic branch of the trigeminal nerve. What that does is it activates the amygdala, which we all know deals with emotions, but it also activates the fusiform gyrus, which leads to the facial expressions. So that is the facial loop. What Botox does is that if you inject in these areas, which is mainly the procerus and the corrugator muscles, it can potentially block the facial loop. And that can, like say, if you're not frowning when you're sad or when you're happy, so that can potentially work as an antidepressant. So we did a literature search, myself and my colleagues, Dr. Sadiq and Dr. Ali, we did this literature search to see whether any studies were done in the past where Botox was used as an antidepressant. And then, surprisingly, yes, the work has been going on since 2012. There's some studies were done, and it shows that there is significant improvement in anxiety and depression in people who are resistant to the normally used antidepressant medications. And however, the limitations are, one is the sample size, and number two, the issue is most of the studies were done on female gender. So we don't know whether it works in males or not. However, when you think of Botox and migraine, whether it is male or female, they inject in these areas only most of the time. The sample size of all these studies done in the past have been small. So still, I think more studies are required to get a robust idea of whether this would potentially work or not. But the information we have so far, based on the literature search, that Botox can potentially be used as an off-license treatment for treatment-resistant depression, moderate to severe, as an adjunctive treatment to oral antidepressants or anxiolytics which we use. The other benefit is that usually when we give Botox, the effect for other medical conditions, they last for 3 months. But the studies done in the past have found that when Botox is given for depression, participants, their mood remains stable for close to 6 months. So which means that even if you were to give another injection of Botox, it can be given 6 monthly. Usually in medical treatments, it is a 3-monthly injection, but for depression, it can be used every 6 months. So currently, the clinical indication is for depression, for anxiety, for PTSD, and even for bipolar with a depressive phase. So that is being clinically indicated at this point in time, although it is still off license and further studies are still required. But this could be kind of a foundation where we can do more research on, because it is already prescribed for various medical conditions. So I'm up for questions.
That's really interesting. I was thinking